So today we're here with Pete, and Pete is a patient of mine. He's been a patient for many years. We've done a lot of different dental procedures on him, but I asked him to come in and share his experience with specifically some dental implants that we did for him. And Pete's story is that from trauma, he lost his lower front teeth, and he had worn a lower partial, a removable denture to replace those teeth for many years. And ultimately that broke, and then he lost his other back teeth, and we did 2 dental implants and a denture, and then we added the second, so he's got 4 dental implants. But I think what I'd like to discuss with you is, how was it and what made you make the decision to let's now do some dental implants?
Well, my teeth were very messed up, and I consider myself young, in my early 60s, and I couldn't chew things, and I wanted to be able to eat normal, and the partials stopped working because those teeth broke, so we had to go with something else, and we went with the implants. Yeah. And I was very skeptical of it because of the expense and the pain, but it wasn't that bad.
So was there pain involved with it for you?
Well, of course there is, like, even if you have a filling, there's pain, I mean, but it wasn't anything like I imagined. No, I mean, no, it wasn't bad at all.
And I find that to be the case. People's perception of having dental implants is like it scares them to death, because the idea of having a post put in their jawbone is like, you know, having their head chopped off. It's never as bad as what you envision. Well,
I trust you a lot,
yeah.
So that's one thing too. I go by what you tell me.
And you mentioned about the expense, and one of the things that I think viewers like to see is, what helped you make the decision to spend the money on the dental implants? You know, we all have decisions in life regarding money, you know, what to spend our money on. What is it about that you decided that it was worth it and there was the value in it? Where did you, tell us about that a little bit.
It was money spent just on me, for my own personal well-being, actually, really. I mean, because to be able to eat steaks and stuff like that is a big deal. And
you know, for our viewers, I want to touch on that, because I see this over and over and over and over again, that I have patients come in that need dentistry like this, but and have the money, but don't want to spend it on themselves. And for you to say that means a lot to me, because that's really, if you've got the money and you want to do something for yourself, nothing gives me more joy than to see patients doing something for themselves, especially those that have raised children and have never spent money on themselves. I think that's a really, really important thing, and I'm glad you mentioned that, because many of our viewers, or many of my patients, don't do the treatment because they don't want to spend the money on themselves. So thanks for bringing that up, because I think that's a good, valid point. So how are you now with these dentures, these lower dentures?
Good. It's very clean. I mean, you just snap them out and clean and rinse your mouth out, and it's just really nice like that. And yeah, I like that part of it, really. Just
the ability to get them out, clean them, put them back in, they're fresh. Yeah. And so you're chewing. How's your chewing? You chew pretty much whatever you want?
Pretty darn good, yeah.
Pretty darn good?
Yeah.
You're not losing weight or anything, are you?
No.
Okay. All right, very good. Well, thank you so much for coming in and sharing your story with us. I mean, I'm sure that there's someone in a similar situation to you that might watch this video and think, okay, you know, that's me. Maybe dental implants are the right thing for me. So thanks so much for your time, Pete. I really appreciate it.
Thank you very much.